eating for hydration. So like when you're little, you get, you know, when I was at the age I was seeing him before, most kids get 100% of their, like your daughter's age. She's getting 100% of her needs through breast milk. The eating is just supplemental. It's teaching her how to swallow puree, how to eat table foods, how to chew, how to do all of that. So it's teaching her all of those things. It's not necessarily for nutrition. So once you hit this age where Ova is, that's when you start eating foods for nutrition and drinking less. So you start seeing that volume of liquids kids are drinking go down and the amount of food go up. So now that we're at this age, we can kind of take advantage of the fact that we don't necessarily love to drink. We can drink water for our hydration. We can drink the Kate Farms or the Pediasure or whatever we end up going with, but we can also use it for making puree and making sure that we're getting that volume of food, and then play with that balance of acceptance of puree and table foods for learning to chew. Once we start meeting our needs at 100% and we're growing and we're gaining weight, then you can start making that transition from less puree to more table food. So as his skills get better, you'll see him eating more and chewing more, and we can start backing back on that puree. Does that make sense?
Yeah.
Okay. So that's kind of where I would like to focus. What do you think, mister? But we're definitely going to have to work through this holding. Because that's going to be, and that's a hard one to break, but we'll work on it. We'll work on it. We'll work on it. You just have to remember.
Is that something you could train a child to do, or they learn on their own, hypothetically?
To swallow?
Or to hold, no, holding.
No,
Holding? So, kids a lot of times will hold for, you know, like for behavioral reasons. We don't necessarily know. It's a hard habit to break once they get in that habit. But it's just another way that kids learn. If I start holding my food, they can't keep shoveling food in. And it's another behavioral technique to kind of avoid eating.
Gotcha.
So it just kind of becomes a learned behavior.
Gotcha.
A lot of times kids will hold food more with solids than they will with puree, because with solids it's like with those little peanut butter puffs or the snap peas and things like that, they kind of dissolve in their mouth and they just eventually swallow them. But as kids are learning to chew, and we start giving them things that don't necessarily dissolve, if they don't chew it all the way, they start holding it. And that's where we start seeing that, the holding, but he's holding complete puree.
Yeah, in all water sometimes. It's so weird. He's never done that before. That's why it's just so
Yeah.
weird.
So.
Yeah, alright.
Yeah, I've never seen him do the holding before either. Like when I saw him before, I never saw him hold food. This is
He's literally never done that his whole life.
a new behavior. Hi.
Yeah.
Yeah, I know. I see.
Yeah, that's where I have like questions for both of you whenever she comes back
Okay.
in. But I can,
Let me go grab her and see. But definitely one of the things that we'll give you guys today for sure is I want you to start, even if in the beginning it's just sitting him down when sister's eating. Do they both have a high chair? Yeah. So even sitting them side by side in high chairs, and in the beginning, just offering him bites when she's getting bites before, so that way we can arrange his tube feeds so that he'll sit down beforehand, eat or offer food, and then get his tube feeding after, so we can get him back on we're sitting down for 3 meals a day. And you know, even in the beginning, I would keep it happy and keep it pleasant, and you know, sister's eating, Ova's eating, yay, everybody's eating, even mom and dad maybe are eating, you know, just to kind of get him back in the routine of I sit and I eat versus everything goes through my tube.
right.
So, okay, let me go see where he is, and I'll be right back. I'll be back.
So Palom's not there?
No.
The nutritionist?
No. She was,
The surgeon?
no.
So only 2 people.
Yep.
Okay.
Yeah.
Makes 0 sense.
The nutritionist was on the phone. You want some
Oh,
water?
okay. I got you.
No? You want water?
But Cologne never called.
No.
Oh, the surgeon. Okay.
No.
Alright. Yeah, what about the blenderized tube feeding? If he doesn't eat it, can we put it in his tube, so on and so forth, to get his stomach used to digesting real food? You know what I'm saying?
Yeah, that's why I'm waiting on him to come in.
And his biotics in his stomach to, actually start working. And while eating, not this thing.
Yeah, I'll ask him to come back in.
Especially when the mono eating he's using keeps throwing up a third of the time, or a fourth of the time.
Right. Mom is back.
She not seen that.
No.
She said she's never seen nothing like this, huh?
Yeah.
Yeah, that's what Fox Mom does, bro.
I need a pen.
And she said it was a learned behavior.
Yeah.
Like she did it on his own or he was taught it.
I would say, yeah. Get my questions out.
So be respectful and
Okay.
search for him.
Yeah. You want to get down? Did you swallow? Yum, 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 yum. Open up. Show mommy.
Oh, but eat.
Did you swallow?
Oh, but drink.
He was opening up for that beef stuff
Right.
before she even got the spoon next to his mouth.
I literally feel like they stuck him in like a dark place and then feed him.
Probably.
Probably locked him in one of those rooms that we heard about and locked him away.
Mm-hmm.
I know a quick way to learn how not to eat.
What?
She told me, whenever the person don't eat. Like when I was on that liquid fasting diet, when I had my lockjaw, I probably didn't want to eat at all, bro. Even after I could eat. I was like,
Let me
yeah,
see.
I don't
Show mommy. Nuh-uh.
I don't do it at
Close.
all.
Close. Swallow. You have a little bit left.
Like when I had my tonsils cut out too, I totally didn't want to eat. Cauterized out, that's up. So like how you said, we should probably get talk to the doctors about this man. Having those symptoms. Like he has those symptoms, it's either him or it's a med. You know what I'm saying?
Mm-hmm.
Gotcha. Right, okay. We're on to all those short ones. Mom had questions. Yeah, Mom, do you have questions for us?
Yeah, I'll try to put that back on there. Okay. Do you have a pen I can use? Oh, yeah, I'm sorry. I was doing it. Okay. It's kind of how it works with them, so beware.
I may not be
That's
able to
fine.
answer, but we'll see.
I don't expect you to be able to answer all of them.
Let's see.
Let me see where to start.
Why is there a dilemma there?
Because he doesn't run the feeding clinic.
Gotcha.
Okay.
I run it, and usually I consult with him for the primary GI things, just because he knows you guys better.
Right, okay, so I more have like a statement I just want to say for, so like I was talking to Kim about it. Do you think that more of he could have picked up this trait from like another child? Because I know like the foster home he is living in, the other child does have feeding problems, because we came here to the feeding clinic with both of them. The other child would come in. Could he have possibly learned some of these traits from that child more so than on his own?
It's a very hard question to ask and to answer. Because feeding difficulty is very complex.
Right.
And it has different things to do with it. So I would say I don't think I'll have a clear answer for you.
Right, okay.
But it's very complex. It's clearly developmental, clearly environmental, clearly food related, but it's hard to say which one swayed him more.
Okay.
And it's very hard to answer that. And
I mean, I have a lot of kids that I see, and they have feeding issues, and they have siblings that
have no feeding
100%
problem.
have no feeding issues.
Right.
Okay.
I mean, it's not. It's I don't typically see kids that like they'll come in and they'll say, you know, oh, my son does this and this and this, and it's just like any sibling relationship. And I know in this situation it's not a sibling relationship, but other kids sometimes they pick things up from other kids, but I don't like this is.
Yeah, and because
It's too hard to say, and you know,
Kim, you weren't able to see if he knows how to chew, right?
Right,
So
no,
that's-
I wasn't.
That
Right.
you don't learn from someone else. That's you
Right.
didn't go through that.
I was
So that's
more
the
so
other
talking
part.
about like the holding.
Yeah,
The
but it
holding,
could be.
more
It
so.
could be again because
Right.
feeding is so complex between behavioral, developmental, and environment, right? So that's that's why it's so hard to answer that question, and I don't think anybody will be able to tell you yes or no.
That's fine. Okay, so one of my questions is, because I've reviewed a lot of like all the paperwork from all the doctors he's involved in, and nowhere does he have any of his family history on it. Why come he doesn't have any, like, if so, where is the family history?
It should be there
Because because on the gastro, like all those papers of Dr. Paloma, it says 0 family history. So I mean,
Yeah.
as someone that's so young and has a lot of issues, it'd be important to know like what his dad had, what I had, like what our parents had. I mean, I would say that that's pretty important considering like anything dietary.
Yeah.
Any of those
I
things.
cannot comment on that because I didn't go back on his notes, but usually it's the medical assistant that sits with you guys before when she rooms them, whether he was roomed with foster care with you guys, they ask those family questions. So they live somewhere in the chart. They may not be translated into Dr. Palomo's note per se,
Okay.
but they should be somewhere in his chart.
Okay.
But I didn't check his chart per se.
Right.
And depending on what the medical assistant ended up getting from foster mom or from you guys, that's what gets put in there.
Okay. And did any of his doctors review any of his primary care physician notes? Like any of those? Did any?
I didn't.
No.
I'm sure Dr. Palomo.
Okay.
Dr. Palomo said he had an extensive discussion with everyone involved with OBA
Okay.
from the get-go. I don't know if he was talking about primary care or Arnold Palmer.
Okay.
That part I cannot comment on. Is his primary care part of us, or is there
No.
a specific reason why you're asking about primary care? Does he have?
He's not. They're not a part of. He has a different one now. So.
Yeah. Okay. Is it because you were worried about something, or
I was
you
just
were
wondering
worried
because
about
like the
something?
connections, like the miscommunications.
They typically, so whoever the primary care on his chart, it gets all our
Okay.
records. So his primary care physician will get his discharge letters
Okay.
from whenever he's hospitalized, the ER notes and Dr. Palomo's notes. They always are signed and faxed to the PCP. So
Okay.
the primary will definitely have our notes. Vice versa, I typically not unless they have a concern and they send to us.
Okay. Okay. When was he? I don't know if he was, or I'm just gonna say when. When was he diagnosed with malabsorption or maldigestion?
Do you have an answer to that, Amy?
So I think it was put on the chart only to help get the pediatric peptide covered, not that it was necessarily diagnosed with it. So, because that was again kind of placed on him.
I can't hear her.
Outside institution, and I think we just
She's on the phone, Dad.
getting it covered, but I don't think he's actually diagnosed with that.
Okay.
So that she's on the phone, but mostly
She's saying I can't hear her.
Hold on.
she's on the phone. That's why you can hear her. But mostly,
Yeah, I
the
know.
reason we put it is for WIC to approve it. So the reason for peptide, the insurance will come and tell you, or why you're giving this child peptide and not regular Pediasure. And more often, it's put in the chart to justify the use of peptide, not because we think he has a malabsorption problem.
I didn't get that.
So he's not diagnosed with it. The only reason they had to put it was so it could be.
Gotcha. So when they did the CREAON experiment, they ruled it out, and so they put it back on paperwork to get him on peptide. to
That
continue to
CREAON
publish.
is Arnold Palmer, right?
Yeah.
I don't know what happened in Arnold Palmer. So I cannot comment on Arnold Palmer and the malabsorption of the CREAON there.
That's the gastrologist, Dr.
Right.
Hudded.
Yeah.
Okay.
So I don't know what, I will leave that question to Dr. Palomo. He likely knows. Yes, if you're putting CREAON, you have a malabsorption, lack of digestion issue.
So this is the surgeon?
No, I think you're head of the gastrologist department,
No,
or
I'm the head of the feeding clinic.
head of the feeding clinic.
So Dr. Palomo should have told you
Oh,
about
okay.
me, because I run the feeding clinic and so on. But I don't know what happened in Arnold Palmer. So if he was on CREAON, he would have a malabsorption issue, right? But like if he's not on CREAON
They
anymore,
took
then
it
he's
off.
on
They took him off of CREAON. So honestly, you basically don't know much about my child at all.
I know what's in my chart, but I don't know what happened in Arnold Palmer, no.
Okay.
Okay.
Because I'm only involved with feeding, right? I'm only involved with OBA with feeding. That's why I cannot answer some of your questions, and I don't think they're relevant to the feeding clinic today. Does that make sense?
Malabsorption, I think, would be relevant to feeding and allergies, but that's me.
No. Feeding clinic has to do with chewing and swallowing, not with absorbing your nutrients. I think that's what the disconnect is.
All right, so let's move on. My next question is why, it's kind of more for like nutrition because she kind of talks to Paloma a little bit more. Why was an allergy test never performed?
So generally with his age, allergy testing could be a little tricky and lots of false positives and not necessarily actual allergies depending on how you're testing. So we generally use reactions to things, vomiting or distension or other rashes as our clue that we have an allergy, and then we test later when it's a little bit more conclusive.
I can understand where you're coming from, but my daughter was tested for allergies at 4 months in this hospital, and they know of her allergies. So, and when I got the allergy test, the doctor asked me, I think it was Steven something, I can't remember his last name, asked me about the other child, but he said that it would be better for them to get tested at an earlier age rather than wait till they're 2. So basically, I mean,
it depends on what allergy you're talking about. So there's GI allergy that you cannot test for blood or skin test. And there's regular allergy that you test for blood and skin test. So if you're worried about a food allergy that triggers hives, triggers asthma, triggers difficulty swallowing, yes, you can test for that blood or skin, and it would be significant for a child his age. But if you're taking about a GI allergy that leads to lack of absorption or lack of or intolerance, that you often cannot check with blood or skin test because it's a different type of allergy.
Right.
It uses different cells, so you cannot test for. So it depends on where your question is.
I'm more wondering about like just normal.
He's on allergy medicine.
Normal
He's
allergies.
has no allergies.
Yeah, I don't know about the citrazine. I cannot say who put him on the citrazine.
Mm-hmm.
I looked in the chart and it doesn't have the physician's name attached to it, so I don't know who prescribed the citrazine.
Okay.
And anybody can refill that. Can anybody pretty much refill an allergy test?
Can anyone refer to allergy testing?
So the
So what
nutritionist,
kind of allergy are you worried about? Like why you doing citrazine, like environmental allergies?
I kind of wanted.
The citrazine is for environmental allergies.
Yes, ma'am.
Okay.
Environmental. I'm
That
trying to
would be
think because my daughter got environmental. She got milk protein. She got all the normal allergies that a child gets. That's what we wanted done for our son, and we've been asking for months and months and months. Yet no one has done it.
So that's a question for his pediatrician to send to the allergist if you're worried about
Correct. That's what we're working
Yeah.
on now. I just wanted to ask like why it was never done mainly.
But from a GI intolerance, that's a hard one. That's a hard one to test for.
Okay. Now, is actual food allowed to go through the tube? So, are you allowed to do, blenderized tube feeding?
No, because it's very thin. It's going to
Okay. It's too thin. The tube is too small to do it.
If it was a G tube, yes. But that tube is going to fly.
That's their practice. That's not truth.
Huh?
I've known people that have NG tubes and they get BTFs.
Yeah, it depends on the thickness of the tube.
When you look at his tube, that's in,
dietitian.
that if you have a bigger size tube, of course. If you're talking about 12 or 14 French, of course. When you look at your son's tube, it's 6 to 8 French. Anything will clog. The pump cannot put it. The syringe will not. That tube is going to clog if you put blenderized dye inside.
Gotcha. So bigger tube. Gotcha.
Hold on 1 second.
The noisemaker, I love it.
I tried to put the towel there to think it would help, but
It fell off.
Oh, it fell off.
Yeah.
It's a top, yeah.
Okay, now I only have 2 more questions. Unless.
Hold on. Is the size of his tube for an infant or a toddler?
No, that it's actually suitable for his nose. That's the infant toddler size. If you go bigger, it's going to be stiffer. If you go bigger, it's going to be stiffer. We usually, like our practice, doesn't recommend blenderized dye through a feeding tube. We recommend it through a G tube, but not a nasogastric tube, just because it's a longer tube, it gets clogged, then you have to change it so often. So that's why we don't recommend it.
Now, okay, so why did Dr. Palomo wait months before he even discussed getting the NG tube taken out and replaced with a G tube when he said that it's only supposed to be there for 6 weeks?
So that's a question for Dr. Palomo. I can't
Okay.
answer on his behalf. Yeah.
Yeah, he wasn't
Neither
supposed
can
to
Amy.
be there.
To what?
Huh?
I thought he was supposed to be there today.
No.
Okay,
So, hold on. Let me get one more question.
Okay.
So, the appointment today is only for feeding,
Correct.
not a surgical conference, right?
No,
Correct.
this is a feeding. The feeding clinic is run by myself, which I'm the gastroenterologist, run by Amy, and
Right.
a therapist. Today you have Kim because she knows Olga from before, but that's how the feeding clinic is run. So we're the team.
My question was, today was just for feeding, not for a surgery consultation.
because we were told otherwise.
No.
Yeah, we were told it was for a surgery consultation. Palomo and a surgeon, all these people would be there, and not even half of them are there.
No.
That's not confusing.
Who mentioned that to you?
The state, a whole bunch of people. We have it on record, and we can prove it. I just want to get past that.
No, that's okay. You don't have to prove it. I just want to make sure where you got the information from, because when
From the
our
state,
staff,
our case
yeah.
manager, and from Respite Care, because Respite Care actually set up this appointment for what it seems like on our paperwork because
I set
she
up this
couldn't get him.
No, Kim set up this appointment after Dr. Palomo talked to us.
Yeah, I set
Yeah,
up this
that's what I'm
appointment with Danielle when he was still in her care, and she said
Yeah.
that she would let you all know. And then I got the Mind and Morris message from Mom stating that Ova had been transitioned 100% to your care. So
Right.
yeah,
But you got the
no,
call from Palomo, right?
I'm sorry.
You got the call from Palomo?
When we got the referral from Palomo.
Yes.
Yes, that's what I mean. So the original respite foster mom, not Danielle, her name is Julie Cayley. She is the one that was setting up this appointment. I have the paperwork to prove it. And
No,
Palomo
I didn't speak with her.
Yeah, I know,
There's
that's
a
what I'm
note in
saying.
this chart where I spoke with Danielle to set up this appointment.
Yeah. Either way, we're going to come see you anyways, Kim, because you're
Yeah,
very
I'm like,
important.
I called to make the appointment.
Okay, so basically a couple of the questions I have to ask are you can't answer them because the people we were informed were going to be here aren't here, so I'm not even going to waste anybody's time.
Someone call Palomo?
He's actually on call today, so he's rounding on the inpatient service. So I would say
Okay.
maybe send him a Mind and Morris message and then let him know that you guys had questions for him.
Okay.
Actually, don't too much. Oh, you go ahead, baby.
So this is more for the feeding, and I already asked that. Just kidding, scratch that. So why wouldn't Dr. Palomo or his office train me to do the NG tube feeding, the NG tube placements when he trained foster mother?
I don't know about that. Again, like that.
Do they do that there?
In our clinic?
Yes.
So our policy for our patients, most often we tend to replace them ourselves. We rarely teach the parents.
So you do?
Huh?
So you do teach them?
No, we usually tell them
Rarely.
to come. Huh? We
You said
rarely, like, the only parents I taught, I myself, it was a teenage kid with a different that he wanted to put it in and out himself. But our
Okay.
policy is to bring you here and replace it because you need to make sure it's in the right placement and so on. So I know other hospitals do it before you get discharged from the hospital. Let me teach you if the NG comes out so you can replace it, but we don't have this here. So I don't know.
That's okay. I mean, I can go somewhere else to get trained. It was just a question because I know foster mom was trained by this hospital and
Mind and Morris?
yeah.
Oh, yeah.
And then they refused to train me. So I don't know if it was some real
No, we
reason.
don't, again, because you cannot do an x-ray, you cannot check.
But they
the
have,
patient
correct.
at all.
But I actually spoke with the lady that actually replaced it on August 20th, and she said they have these strips that you have.
Yeah.
And that's what they used when they replaced it the second time at a different hospital. They take the strip and they
check for acidity.
test.
Yeah.
Correct. So that's what they give. The people can buy on their own. But my last question is, why did Dr. Palomo call DCF on us?
Again, I am not Dr. Palomo. I don't know what happened with you guys and Dr. Palomo in the past. Please don't put me in this
No,
situation.
I'm not. I'm
so I
just
don't
saying
know.
that
Again, we here.
I don't know if it was he was told to do it or if it was to set us up, but regardless of that, all I can say is we won't further be seeing Dr. Palomo. I already have him set up for a different GI. Do what? Yeah, no doctor except for Kim is who we are going to be seeing here anymore because that's who it's the only person I feel comfortable seeing.
So
and
that poses a bit of a problem.
Exactly, yeah.
Because with our feeding team, we work closely with the GI and the nutrition to make decisions moving forward. It's a team approach. So yes, you see me for therapy, but if I have concerns, like for example, with the holding of food, if we come in and we're continuing to progress through therapy and he's doing well, he's accepting, but we're still seeing this holding, and I have concerns that maybe there's some other medical thing going on that's causing him to not want to swallow. I then take that concern to Dr. Haddad, who conferences with Dr. Palomo, and figure out from a medical standpoint, are there some other things that we need to look at and look forward with? So I need that team approach. If he has a GI at an outside provider, I don't have that ability to communicate with them. And so,
and our feeding program only sees internal patients.
Correct.
We don't see external patients yet.
we only see patients
So
that are
internal meaning
sent to us
managed
from
by-
our GI practice
Okay.
because of the high wait list that we have and things like that. So that's where, if he's going to be seeing a GI outside of Newark, I can make recommendations. I have other friends in the community that do feeding therapy and things like that, but I apologize, I'm not able to see kids outside of our practice.
Okay. Do you have anything to comment on that?
Me?
Yeah.
I don't know. We'll see how it goes. I'm definitely not going to someone that called DCF on before my child was in my care. That didn't do a lot of things he should have. They didn't fill out the paperwork correctly. A whole bunch of things. Dr. Palomo is not a good doctor. That's my opinion, and that's where I was going.
So, I mean, basically,
we like you, we love you, but
we just don't feel comfortable. It's now a conflict of interest, seeing Dr. Palomo, knowing that he called DCF on us.
That's when he knew he was coming into our care.
Probably.
He was going to shorten a visit, do all these things. We literally have all the paperwork.
So, yeah.
Yeah, so that,
We're
like,
not going there.
that obviously.
And then you just told me, ma'am, you just told me you have trained someone there, but you want to train us, basically.
Say that again?
You said you trained someone there to put an NG tube in, that you guys rarely do it.
So please don't like hammer on words. When we say we rarely do it, I was telling you a teenage patient who put it himself, not a toddler. We don't have a policy. I don't have guidelines. I don't have my nursing support to teach you guys. So
Right, fine. That's understandable. We'll go to a place that can. You know what? Lost everything we can do for our child. Try to help our
which
child
is
out.
definitely understandable, right? Like this is your child. Do whatever.
I just don't feel it's adequate when you guys are open 24/7.
But please don't take it that we're refusing to teach you. We just don't have the policy to do it, right? And when I start thinking about a feeding tube, I just start thinking, how long can we keep it in place, right? And so on. So that's a different discussion. But yeah, like I would say, do what you think is best for you guys. But in the Morse, we don't have and Amy could be
But
my.
you can write a referral to get that done, though, right?
Say that again.
You can write a referral to get that done for us, right?
Refer where? I don't understand, Dad. What referral do you need me to do? To replace an NG? We don't have policy with Nemours to do that referral. I don't think you're getting the picture.
Gotcha.
Like we don't have, we have a policy at Nemours that the parents don't change the NG tube. I worked in other hospitals in other states that we teach parents to do it. But in Nemours, Orlando, we don't have that policy. Yes, did I teach it to a teenage of mine? Yes. But like for an infant or a toddler, we don't have a policy in place for Nemours, Orlando to replace NG tubes at home. And correct me if I'm wrong, Amy.
Yeah.
Yeah. And I don't know.
I've seen it been done in older patients.
Right.
But not necessarily in
And I've seen it done in other hospitals. I don't know about Florida. I worked in other states and other hospitals do them, but not Nemours, Orlando, right? I'm just talking about the environment I'm in right now.
Right. You're okay.
Do you have anything else to add?
I thought Palomo was going to be there. Most of my questions for Palomo.
Same.
Playing the drums.
I don't know. Is Kim gonna try to continue feeding, or how are we gonna do that transition if there's a transition? Because we're not going Palomo, period.
I can't do it if he's not seeing a GI in
Okay.
And
No, I just want to make sure you didn't schedule us up if you know.
No, we hadn't gotten to that point.
No.
Okay, yeah, we're definitely sorry, Kim, but yeah, we're not going to Poma.
No, I understand. You have to do what's best. Are you? Can I ask where are you guys living? I can see if I'm trying to think of if I know anyone that does feeding therapy in the area.
Titusville, Florida.
Titusville. So you'd have to come to Orlando. I don't.
What about early intervention?
Yeah, you could try early intervention. They come to the house. Actually, that's I can get you.
Ability Plus in Melbourne that does really good feeding.
What is it?
Ability Plus.
But does early intervention do it with an NG in place or?
I don't know. They may. Yeah, they may. I'll give you the early intervention. You can. It's a self-referred program. You can contact them yourselves to have the evaluation set up. It's a one-time evaluation at a center, and then they set up the therapy and they come to the house and they will see you there.
Sounds great.
So, and would you say, Amy, Mobilities Plus?
Ability Plus.
Oh, Ability Plus in Melbourne.
It's not a Titusville, but I know they do feeding therapy there.
Hi, where are you going? You're going there? Oh, okay. Yeah.
I'm trying to think. Yeah. So I will go get you that information. Do you have anything you want to add to the medical part of this? ABS?
I don't think so. I think that the thoughts were the Cape Farms, the trial of the regular Pediasure,
I copied all of that forward from Amy.
and then prolonging the duration of the bolus if he keeps throwing up despite change of formula, basically. That's
Okay.
what we need to do. Yeah, and that should help.
Does any of them know where you could get training for the NG tube?
I don't know.
No.
Amy, do you know, like, does Advent Health or Arnold Palmer do it?
I think Arnold Palmer might, but I'm not super familiar.
Okay. The only 3 peds GI that are in the area are us, Advent Health, and APH. So maybe you want to ask Arnold Palmer or Advent.
I would say I don't know who trained foster mom, but it was either
a lot
here
of foster
or
moms, because they have medical background, like especially the foster mom that will take an NG,
no. But she specifically told me she was trained by.
by the Moore.
Yeah, in the state too.
Yeah. Then I don't know. I cannot again.
You're probably a lie because they lied a lot, but I'm just saying that's what they told us.
Yeah. And a lot of them, especially when they take like they take kids with nasogastric tube, they're kind of a medical foster care. So they all have knowledge with it. But I don't think, were we the ones that put in the NG or Arnold Palmer?
No, I
Arnold
think
Palmer.
we did early on.
We did early.
They probably replaced it.
Okay.
Arnold Palmer was the one that originally placed the NG
Okay,
tube.
so that's could the foster mom have learned there, and she just said us, right? Yeah.
That's cool, yeah.
If the original placement was an Arnold Palmer, they probably told her what to do at the hospital.
She only came here because she got switched to this GI because the original GI wasn't going to release my son in her care.
Oh, so maybe
That's the only reason why she came here.
So she maybe met them at the hospital, and that's how they told her, and then they should transition it to us. Maybe I'm trying to speculate here, but I don't know.
She didn't really. Never
Yeah.
mind. I'll just not comment.
But unfortunately, it's not on our policy.
No additional medical recommendations at this time.
No.
Just all nutritional. Okay, perfect. Okay. So, I'm gonna go grab you the information for early steps.
Already been there.
What was that, Dad?
He's already been there early steps, I think.
Oh, so is he already in their system?
Yeah, he was there. He was doing PT. He got released, I think.
Yeah.
So maybe
Okay.
they can
Well,
do
but they
feeding.
could then pick him up for feeding therapy.
Yeah.
And
Sounds
where before he may have been doing it,
PT.
yeah, when he was doing the physical therapy, and were they doing it at the foster house?
I don't know because we only been once and we were never invited after that, so I can't really tell you, and we can't even find out the paperwork right now.
Okay, yeah. So I'll give you the number where you can call them, and you can actually say, that my son's been in your system. And they can help get you set up, and you let them know that now you're interested that you have feeding concerns.
Beautiful. Thank you.
Yeah. All right. So I'm going to go print this out. I'm also going to give you a copy of
I think you're good.
I'm going to give you a copy of this, which is how to obtain copies of the medical records,
Yeah.
because
And the week
you
form.
may want to take a copy of my evaluation today to them.
Okay.
So that way you can get it.
Right.
And there's a week form that Amy printed that should be on the second floor with the GI office. So
Okay.
that will have the regular pediatrician.
So I go to the
if you wanna
second
try
floor for
Yes,
it? Okay.
yes, yeah, and let them know to print.
Yeah,
that.
because the WIC office is just waiting for a prescription to put them on any, so I can buy
Yeah.
with the WIC.
Okay,
And
yeah.
I requested the K Farm samples as well for that'll be sent to you guys to try out. And
Okay.
see how you
And
like
go to the second floor
I'll be
for
right
that?
back. Yes, no, the Cape Farms will be shipped to your house.
Oh, okay.
But the Pediasure week form will be.
Oh, okay.
Will be. But if you like the Cape Farm, then you have to apply through the insurance. If you
Okay.
transition to another GI, ask them to run that through the insurance. But the Pediasure, the week form will definitely give. And if he tolerates that better, then perfect. Cool. Do you have any questions for Amy?
Do you have any
My
questions for
phone is
Amy?
going.
No, not that I know. I'm good.
No. All right.
Okay.
For
We're
sure.
good.
Thank you.
Okay.
I think I'll do the BDPF, so it's no big deal.
All right.
Alright.
Okay.
Thank you, everybody.
I took you off speaker because there's no one else in here except for
Yeah.
the other lady.
Bye bye. I'm leaving too. Yeah. Bye bye.
Bye. Thank you.
Bye.
No, Kim is printing the paper. Oh. Yeah.